Okay, so for group 10, our case had mainly focused around ATP, or also known as acute tonsillar pharyngitis. And so our case had focused on a 45-year-old female patient by the name of RV. She was born on May 5th on 1973, is married and lives in Quezon City. Her main dental chief complaint was that she wasn't able to eat properly since she had no longer had a denture. So whenever she ate, it would hurt her gingiva. For her medical chief complaint, she had explained how it was hard for her to swallow food or drink because it would hurt too much. And so for her HPI, when it was 2018, she had noticed that her upper denture had a small fracture around the palatal area in the middle, and so it would sometimes dislodge whenever she spoke or opened her mouth widely. 2 months later, she had noticed more of a consistency. Of dislodgement with her denture, which is when she noticed an even bigger fracture on her denture, prompting her to only wear it when she goes out. For her medical HPI, 3 days prior to consult, the patient had noticed stiffening of her neck upon waking up, and pain in the left post-auricle area. She had rated this pain a 10 out of 10, 10 being the worst. The pain was aggravated by swallowing, leading to dysphagia and decrease in appetite. The patient had also experienced a headache and joint pain, which was rated around a 3 out of 10, 10 being the worst, prompting to self-medicate with 500 milligrams of paracetamol, which had temporarily relieved the pain. And so later that day, the patient was feeling chills and nasal congestion, prompting her to seek treatment at UERM. And so upon examination there, she presented with a temperature of 38.1 degrees Celsius. For her past and medical history, in 2012, her remaining teeth were actually extracted due to chronic exposure to caries, and they were unrestorable. 3 months after this, she had sought consultation with a dentist and had dentures fabricated. And so now around 2017, she had a nasal polyp and she was given nasal spray, which had then resolved the issue. In 2018, she had lichen simplex chronicus bilaterally on her legs and it was resolved. She had hypothyroidism and took L-Troxin 25 micrograms a day. And finally, she had allergic rhinitis to smoke and sudden changes of weather. For her family history, her father has type 2 diabetes mellitus, and her mother has breast cancer. Moving on to her personal and social economic history, she had an absence of habitual smoking, but occasionally drank alcoholic beverages. She does not use drugs, and she works as a sales secretary at PL Aguila Manufacturing. Now moving on to the review of systems. For both the dental and medical, the skin and head had presented as normal with no pertinent findings. Eyes and ears were normal as well. But upon examination, her nose had actually presented with congestion. The throat was positive for soreness and dysphagia, and neck was positive for lumps and stiffness of neck. For the oral cavity, she had presented with fair oral hygiene, and medically, her nose had presented normally. For breast, respiratory, and cardiovascular systems, they had all presented normal and had no pertinent findings. For muscles, bones, joints, legs, and the gastrointestinal system, she had presented as normal for both dental and medical. For the genitourinary and neurologic, she had also presented as normal. And finally, hematologic, psychiatric, and endocrine had all presented as normal.
For the objective general appraisal, patient is awake, alert, and cooperative. The patient is responsive to stimuli and has short hair, light brown in color. Clothing is well kept and appropriate for season, and she is oriented to place, time, and answers to all questions appropriately. For the vital signs, all are normal. For the blood pressure, 110/70. For the pulse rate, 77 beats per minute. Respiratory rate, 18 cycles per minute. And for the temperature, 36.7 degrees Celsius. For the physical examination, for the weight, 57 kilograms, height, 5'1", and her BMI score is 24, which is normal. For the physical examination dental part, extraoral examination, patient's face is symmetrical, She has a straight facial profile, absence of TMJ clicking, no signs of swelling and lesions, and her lips are normal with no lesions and ulcerations. Her lymph nodes are not palpable. For the intraoral examination, she has a fair oral hygiene, no permanent teeth present, and the gingiva is enlarged, bright red in color, and her tongue surfaces are normal. For the patient's chart, there are no teeth present. For the physical examination medical part, um, for the head, all normal with no complaints. Eyes and ears, all normal with no complaints. Nose, throat, and neck, normal, no complaints. For the skin, lymph nodes, and neurologic, normal, no complaints. Breast, heart, and thorax, normal, no complaints. For the abdomen and gastrointestinal, normal, no complaints. And for the upper and lower extremities, normal, with no complaints. For the assessment, dental assessment is a dental arch. For the medical assessment, acute tonsillopharyngitis. For the plan, the diagnostic plan for the dental, preliminary oral examination, impression taking, fabrication of complete denture, and the try-in for prosthesis. For the medical, CBC, throat swab, abdominal palpation, leg palpation, and assess for scarlatina. For the pharmacologic treatment, dental, there is no needed. For the medical, prescribed coamoxiclav 625 milligrams tablet 3 times a day for 7 days, Sinopret forte tablet for 5 days, omeprazole 40 milligrams per tablet, 1 tablet 30 minutes before breakfast. For the non-pharmacologic treatment, dental, fabrication of complete denture, and for the medical, gargle with warm salt water, increase fluid intake, and consume soft foods to prevent irritation.
Our group chose this journal titled Complete Denture Fabrication Supported by CAD/CAM by Wimmer et al. Taken from the Journal of Prosthodontics and was published last 2016. For the background of the study, the conventional method of fabricating complete dentures has been established for over 80 years. It allows for modification and arrangement of teeth and the evaluation of treatment steps before delivery. The inclusion of CAD/CAM technology for the fabrication of complete dentures may reduce cost-intensive laboratory works, and present report of clinical treatment provides a step-by-step description of CAD/CAM supported method for fabricating complete dentures. Significance of the study. The inclusion of computer-aided design, computer-aided manufacturing, or CAD/CAM technology in complete denture fabrication facilitates this procedure. And for the conclusion, the presented workflow for complete denture fabrication combines conventional and digitally supported treatments for improvement dental care. With the presented technique, the registration of the occlusal plane, the determination of the ideal lip support, and the verification of the maxillomandibular relationship, records are considered. For the dental relevance, with this technique, dentures are fabricated without the need for cast, flasking, or other processing methods. The dentures may be easily duplicated with digital data, and research in this field is facilitated. A further advantage is that virtual arrangement of the artificial teeth is a reproducible procedure enabling predictable results. And for the expert's opinion, most patients do not know that you need to replace dentures after certain years. As dental students, you should be able to explain it to your patients. The anatomy of the oral mucosa changes over time, and in CD patients, the ridges recedes due to the bone loss, and thus it alters the fit of the denture. The denture becomes loose and could cause complications such as sores, lesion, and discomfort. It is essential to keep yourself updated with the new technology, and CAD/CAM is actually widely used in other countries, not only in prosthodontics but also in restorative departments. The great thing about doing digital is that the amount of time you could save, the accuracy it could give, and the replicability that you should store it in your digital devices. However, more clinical and laboratory research is necessary to evaluate and validate the new computer-aided treatment procedures for fabrication of complete dentures. as was said by Dr. Delphine